I sat down for a wide-ranging interview with Massachusetts Senator Elizabeth Warren yesterday. I began by asking her about former U.S. Attorney Preet Bharara, who was fired last week by the Trump administration. And since it's entirely customary for new presidents to replace U.S. attorneys, I wanted to know why she thought this was different.
First of all, the president said he was going to keep him, so this is not your standard. This is a guy who was going to stay there. And then the president decides that he needs to have a phone call with him, which we know is a violation of ethical standards, that presidents are not supposed to be talking to the prosecuting.
I should note the White House says it was a thank you for your service courtesy call.
You know, whatever it was,
Right.
It was a phone call that was not supposed to occur. And only then does he get fired. And the particular guy who gets fired is the one who is in the area where Trump Tower is, and who presumably would be the one who would investigate all kinds of things that go on, including the allegation that the president made that that Barack Obama tapped his wires.
So what, I guess my question to you is, if the idea is that the concern is that there was some sort of untoward concern that Bharara was investigating the president in some ways, and he had to get rid of so he could be replaced with his own person, right? What could be demonstrated to allay that fear of yours?
You know, I think the concern is the whole Justice Department now. You know, this is a president who fired his acting attorney general. It's a president who decided that he wanted Jeff Sessions and wanted to keep Jeff Sessions even after it became public that Jeff Sessions had lied to the Senate over his own. Of course he did. I mean, that's just, he didn't tell the truth. You want to pick another euphemism for it? He told a boo-boo. I mean, pick whatever word you want. But the point is, he did not tell the truth and didn't have to come back and be accountable. And I think what's going on now is a fundamental question in our government about whether or not the Justice Department, including our U.S. attorneys, are truly independent and committed to the rule of law, or whether or not they are tame and more committed to Donald Trump and Donald Trump's agenda.
We now have the CBO score for the replacement bill, the repeal and replace bill. It looks like 16 million people lose their health insurance in 2018, 24 million by 2026, a huge bulk of that coming from Medicaid. The line from, there's two lines coming from Republicans. One is we're going to cover everyone, we're going to expand coverage. That seems implausible. But the Paul Ryan is, we're not going to win a beauty contest with Democrats. I'm quoting him on coverage, that this is about freedom and choice. Freedom and choice?
Freedom and choice to have a heart attack and not have any health care coverage. Freedom and choice to have a child with complex medical needs and not have any kind of health care coverage. Freedom and choice to need access to nursing home care and not have any way to pay for it. You know, it is only the Republicans who can come up with this kind of doublespeak. There is nobody in America who thought that knocking millions of people off their health insurance was the way that we were going to improve health care in America. And let's be clear, because even after all these people are denied health care coverage, they're still going to get sick. They're still going to need help. And that means one of two things is going to happen. Either we're going to have community health centers that are not going to get reimbursed for the care that they give. We're going to have rural hospitals who are not going to get reimbursed. We're going to have hospitals, doctors, everyone in the healthcare profession is somehow going to have to absorb those losses and either pass along the cost to everyone else or find other ways to cut their care, or it's going to bankrupt families. That's the only way this goes. You know, and that's the part that's so frustrating about this. Look, there are a lot of things we needed to do and still need to do to improve the Affordable Care Act. There are ways that we need to work to bring down the cost of health care for everyone. And we were working on those. We continue to work on those. There are things we can do. There are ways we can change the compensation system around it, for example. There are ways that we can make better investments in low-cost health care, like preventive health care, so that we don't have to pay as much at the back end on health care. But at the end of the day, it's about delivering health care services to hardworking people across this country. And if we fail to do that, then this is a serious economic blow to America's middle class. This is just a punch in the gut, saying, hey, more and more of you are on your own. That is wrong economically, and it is wrong morally.
I'm glad you spoke about patches to Obamacare, because one of the things that's happened, right, is that that conversation's been lost because of repeal and replace, right? So one of the arguments that Republicans in the White House make that seem to me arguments that Democrats should take seriously is this choice question in a third of U.S. counties, right, that are down to one insurer in that county. You see a real kind of geographic divergence of how well the system's working. It's working fairly well in Massachusetts. It's working in a lot of states, particularly with expanded Medicaid. A lot of places like Arizona, it's not. What is the solution? If the Republicans didn't exist, if you, Elizabeth Warren, and your colleagues could say, here's what we want to do, what does that look like?
So I want to do exactly what we did in Massachusetts. And that is, we passed our initial law back in 2006 with the aim of having both universal coverage and in driving down the cost of health care. We just looked at the numbers and said, we got to do this. But here's the key. We kept adjusting. We kept adjusting how we did payment. We kept adjusting how we did Medicaid. And then when the Affordable Care Act came along, we didn't just say, oh, that's okay, we've already fixed this problem. We said, wait a minute, there are new opportunities here. There are new obligations here. We want to integrate this. And that's what we've done. Healthcare is not something you can come in, you can write one law and say, okay, we're now done with this, unless your idea of healthcare is let's just knock people out and not give them the coverage that they need. It's something you got to work on. And you got to keep dialing in on the pieces. As it gets better, you need to make it even better.
So I've noticed something, and I'm curious because you work with these individuals. So two people that have been very prominent critics of the House bill are Tom Cotton and Rand Paul.
Yeah.
And I can't help but notice, now they've been attacking it from the right, okay? But I can't help but notice that these are two states that did expand Medicaid, Arkansas in a kind of somewhat strange way, the private option it's called, Kentucky in a more straightforward way. But they have really driven down the rules. I mean, how much do you think what's driving those two individuals, their ideological disposition aside, the fact that their own constituents would take it on the nose?
In other words, are you asking how much is reality?
Right.
Now sticking its nose into the ideology here? And the answer is a lot. There are a lot of people in Arkansas, a lot of people in Kentucky who say, wait a minute, it may not be perfect, but boy, this is a lot better than what I didn't have before. This is a lot better than a system where I could be thrown out for pre-existing conditions. This is a lot better than when I didn't have some help getting health insurance. Again, the measure is not, is it perfect? No, it's not perfect. That's what we got to keep working on. The measure is, are we moving it in the right direction? And I think both Cotton and Paul are making an admission, yeah, the Affordable Care Act moves us in the right direction.
You've written a letter about your concerns about Jared Kushner in particular and his conflicts. He's part of a massive construction empire. Yes. We still have not seen his disclosures for the Office of Government Ethics. We don't know what's been filed. There's news recently about a big deal with a Chinese firm that's happened in one of his apartments. What is the concern here that you have about the level of conflicts happening? Take bracketing the president for a moment, right? Just an individual like Kushner.
You know, but I don't want to bracket the president,
please.
if you'll permit me, because the real point is one of, you know, it starts at the top in terms of what the rules are going to be. We need to know that our public servants are working first, last, and in between for the American people, and that they're not keeping just a little eye out on how well it feathers their own nests. And that's true for the president, that's true for the president's family, and that's true for the president's team that he assembles. And one of the things that has just been deeply shocking about where the Trump administration has gone is that they have brought in people and said, hey, you know, what the heck? Wilbur Ross says he's going to be Secretary of Commerce, make a lot of decisions on how business goes, but, you know, he's going to keep $1 billion interest in his oil tankers that are all around the world, and he's going to maintain interest in 11 different corporations while he is the Secretary of Commerce. Rex Tillerson, we asked him, we said, hey, listen, you've been at Exxon forever and ever and ever. You've been CEO. You've done everything you can on behalf of. Can we at least have a promise that while you are Secretary of State, that you will recuse yourself in matters that are going to directly affect Exxon? And his answer was no. You know, I'll do it for a while, but then, shoot, I'll wade right into this. It's the notion with the president's own family, with the president's own team that he has assembled, that that there is a giant blurring between who exactly are they working for? Are they working for the American people? Are they working just to make themselves richer? Or is it some secret blend somewhere in between? The American people should never, ever have to ask a question like that.
Let me ask you this finally. The president has spent, and I think I'm reciting this correctly, 15% of his time as president at Trump properties.
Yeah.
He's gone to Mar-a-Lago. He's gone to Trump golf courses. Is that appropriate? Is it? I mean, look, this is the Mar-a-Lago. He owns it. It's his home. He wants to go play golf. I'm sure I would want to do the same if I were him.
But what is he doing when he does that, other than promoting Trump hotels, promoting Trump golf courses, and promoting his Trump brand? Like I said, being president of the United States is an extraordinary honor and an extraordinary responsibility. And the American people should never have to ask the question about any decision, no matter how small, about whose interests are coming first. And with Donald Trump, every single day, he does things that sure seem to help Donald Trump.
All right, Senator Warren, appreciate your time.
It's good to see you.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.